Kaiser is a pretty large healthcare system. They did a study for 20 years using 43,000 patients, and what they determined was for every rise of glucose 1 point above 84, for every 1 point rise, that correlated with a 6% increased risk of developing type 2 diabetes above 84, which means from 85 to 95, that's 10 points. So if your fasting glucose is 95, you have a 60% chance of developing diabetes, compared to people whose fasting blood glucose was less than 85. The problem with fasting glucose as a diagnostic tool is it's too late. Your fasting glucose could be normal, but you could be diabetic for 2 to 3 years, because it's very difficult and expensive to do something called the oral glucose tolerance test. That tells us how fast and how high your blood sugar is elevated after you eat. I mean, a typical thing is a bagel with jelly, okay? So when insulin rises, lots of other inflammatory markers rise, and this 90 to 100 level is just not okay anymore. You're already on your way. 100 to 120 is pre-diabetes, and 120 is diagnosable as diabetes. It's a pretty large study that proved that.